80% of Americans report having been on a diet of some sort in their lifetime. And every single year, 44% of Americans go on a diet, the weight loss roller coaster. It has physical, mental, and emotional impacts. So, what do you do when you've tried everything? Check this out.
Yeah, this is one of the pictures. When I see this right here is when I was at my biggest, one of my biggest weights, close to, I guess, around like 500 some pounds.
If you didn't know it was him, you might not recognize Wesley Nicholson in these pictures.
When I got under 400 pounds, that was one goal. When I got to 350, that was another goal. To get down to my high school back in '98, I was weighing 325 playing football. So to get back to that at since '98, once I got back to 325 pounds, I was like, okay.
The pictures show the change, but they're not the only part of the story. Wesley works out at home, walks 10,000 steps at work, eats better. He and his wife help keep each other accountable, but it's Cone Health's Healthy Weight and Wellness program that got him back on track.
They encourage you. They give you the steps, the tools to work with. I think it's a good program.
The Cone Health Healthy Weight and Wellness program helps children, adolescents, and adults that struggle with obesity.
We get their weight history. We want to see what their background is when they land here, what kind of issues they've had in the past with their weight, genetic predisposition, any medical comorbidities that are weight related. And then we look at what they've tried already, what has failed, what has worked. And then they come to us, we do metabolic testing on every patient.
Wesley had weight loss surgery years ago. It worked for a while, but his lifestyle didn't change until he got into this program. Now it's been 2 years, and he wants anyone struggling with their weight to know this.
You just take it day by day. And I think a lot of times people are looking at where they want to be by looking at people in magazines or TV or where their success is, but they didn't get there overnight. You take each day of how to eat better, how to walk, but you just take each day and just keep working at it.
We just heard that person's successful weight loss journey from making lifestyle changes. Dr. Edgardo Maldonado with Cone Health Healthy Weight and Wellness is with us. So let's just first tackle this, because I think a lot of people feel this frustration. Why is losing weight so hard?
I think the first thing that we need to realize is that this is a chronic disease, just like any other chronic disease. It's not personal failure. And, it's a complex interaction between our genetics, our environment, stress, lack of sleep, right? Our food has kind of degraded, our lifestyles have become more sedentary. So it's a very complex interaction between these influences. Now, what people don't realize is that, when humans evolved, we evolved in scarcity, during times of famine, right? So we have these protective mechanisms that help us conserve energy. So anytime we try to lose weight, our body feels threatened. So in an attempt to protect us, he will increase your hunger hormones. He will decrease your sense of fullness. He may also have an effect on your metabolism. And that's why losing weight is very difficult. And a lot of people have weight regain as a result.
All right, and is that kind of the same, what you just described, the same as like the biology of why some people have a harder time losing weight?
So there are differences in genetics, and that's why you sometimes see that obesity could run in families. And now there's some researchers at the Mayo Clinic that have developed some testing that could give us more insights into people's biology. But that's the reason why not all diets work for everybody. That's why some people respond very well to GLP-1 medications and other people don't. The same thing would apply to gastric surgery.
All right, so when it comes to weight loss, a lot of times we focus on the number that's on the scale, right? We just want to get to that different number on the scale or the amount of weight that we lost. What should we focus on instead?
I have some patients that just have a horrible relationship with their scale. They kind of tell me, well, my scale's really mean, talks back to me. And I really tell them to focus on your overall health, right? Kind of look at, hey, how is my blood pressure doing? How are my blood sugars doing? Am I sleeping better? Am I able to walk without feeling winded? Am I able to do things now that I couldn't do before, right? Kind of focus on those non-scale accomplishments, which could really add up.
Okay. So for people who may be really eager to get started losing weight, they just saw that story of Wesley. What are some of the first steps that they should do to get started?
I think it's figuring out your why, right? You need to have a strong why is it that I want to lose weight? Second, start off simple, but be very specific. Don't just say, hey, I want to lose weight. Say, hey, you know what? I'm going to start walking 10 minutes during lunch. I'm going to eat more fruits and vegetables. Um, Partner with a healthcare provider or a multidisciplinary team because that does increase the chances of succeeding. The other thing is garnering support from your family and friends, controlling your environment, right? Make sure that your environment is set up to help you succeed, right? So reduce the presence of ultra processed foods, have the availability of healthy foods, right? That helps a lot of people kind of get started.
All right. So when people think about, you said, getting more fruits and vegetables in your diet, when it comes to eating a healthy, balanced diet, what does that sound like and look like to you?
So a healthy eating pattern is basically a diet that's high in fresh fruits and vegetables, right? You want to look at variety, you want to look at textures, you want to get all those nutrients and vitamins that nature offers us, right? Getting about 5 servings per day. Whole grains are also important. That's where you're going to get your fiber, you're going to get nutrients. And you want to get about 3 servings a day of whole grains. That's your brown rice, your quinoa, your whole wheat. You also want to leverage the properties of protein, right? So eating lean proteins like chicken, turkey, fish, tofu, eggs, low-fat dairy. Proteins tend to help you when you're trying to lose weight because it gives you that appetite suppression. It also helps preserve muscle mass, which sometimes occur as people try to lose weight. Healthy fats also play an important role. The thing is, we really cannot eliminate any particular food because we can't get all of our nutrition from just one type of food. And that's why I think diets that eliminate certain groups
Mhm.
of food may not be the most balanced way to eat.
So a lot of people say, okay, what about the fitness part of it? How much physical activity do I need to do?
Well, I think you cannot out exercise a bad diet. That's the first thing. But exercise is definitely a critical component to any weight loss journey, particularly as patient gets to the maintenance phase. So it really does help preserve muscle. Helps protect you against muscle loss, especially with the GLP-1 drugs and when people are losing weight. But it improves insulin level, insulin resistance. People sleep better. They build more stamina. The muscle is like a hub that actually is in charge of systemic health. So it actually influences other organs. But patients also note right improvements in stress. They sleep better. They also notice improved appetite control. And what we recommend is people getting about 150 to 300 minutes of moderate aerobic activities. This is like walking, dancing. We also want people to do strengthening 2 to 3 sessions a week. That includes weights, bands, right? Exercises like yoga, Pilates. That's also a form of strengthening. Being more active throughout the day, trying to get about 5,000 to 10,000 steps. But in reality, just start where you are. Even 10 minutes of walking a day counts.
Right, you don't have to go right into 1 hour of working out and running 6 miles. It can start in small increments. All right, let's talk about how important sleep is to weight loss.
So people that get inadequate sleep, right, have problems with increased hunger signals. They also have problems with cravings, and for the most part, they feel tired, right? So they don't have that energy to be able to get involved with physical activity. So sleep is really important.
Okay, let's talk about results because I think so many people, they start a workout and they're like, I want to see some results really quickly. What is a realistic expectation of seeing some sort of result?
So everybody loses weight right at a different rate. It depends on what you're doing, but what's considered safe and sustainable is 1 to 2 pounds a week. Anytime you try to lose weight quickly, it never really sticks. Again, it's not about the speed; it's about making these sustainable changes that help you maintain that steady progress. That usually gives people that weight loss maintenance.
Cone Health has resources available for people who want to have this healthy weight and wellness journey. Talk a little bit about that program.
Yeah, so the Healthy Weight and Wellness Center, we are a medical weight loss program. So this is a medically supervised program focused on obesity as a chronic disease. Our providers there are board certified in obesity medicine. We also have a medical fitness facility called Sagewell, which they have exercise specialists, they have nutrition, cooking classes. We also have registered dietitians, and we have an excellent group of primary care doctors that are very motivated and to help our patients start their journey.
Okay. And real quick, what kind of advice might you have for people to stay motivated and sticking to that lifestyle change long term?
So kind of focus on, again, on your why, right? Celebrate those small accomplishments. Make these lifestyles about you. This has to fit your lifestyle, or else you're not going to be able to stick with it. It sounds like it'll feel like a diet. It will feel burdensome. So this has to be enjoyable and sustainable in order to guarantee long-term success.
And reach out and get some help. You don't have to do everything on your own.
Absolutely not. And Cone Health is here to help you along the way.
All right, we thank you so much for your time and your expertise. If you missed this, maybe you need to send this to a family member or a friend. This is going to be in the To Your Well-Being section of our website.